skull is really nice though. Cool skull.
Yes, pretty cool. Go on.
Norma Occipitalis, which you can see here in these. Norma Occipitalis is convex upwards, and it is on each side it is flattened below. Convex upwards.
Convex upwards, flat and below.
Bone seen posterior part of the parietal bones you can see thoda. Posterior part of the parietal bone. High गिर मत.
तो छोड़ दो उसको. हाँ.
फिर उसके बाद the upper part of the squamous part of the occipital bone. This is the squamous part of the occipital bone that you see. This is the squamous part of the occipital bone. And mastoid part of the temporal bone. Mastoid part of the temporal bone.
So you see the parietal bone का पिच्चू, occipital bone का squamous part, and mastoid part
of the
temporal bone.
Now we talk about the lambdoid suture that we already talked about between the occipital and the parietal bone. Now sutural Wimerian bones are common along these sides. You can see these sutural or Wimerian bones, and even the skull is very prominent. You can see the Wimerian bones, and in this diagram also you can see the Wimerian bones.
रुक जा बेटा, हाँ. See, that is the Wimerian bones.
Yeah.
They are prominent in the in the lambdoid suture. That is the lambdoid suture.
Okay, now there's occipitomastoid suture.
Oops.
Okay. Occipitomastoid suture here. Between the occipital bone and the mastoid part of the temporal bone. Then there is parieto-mastoid suture between the parietal bone and the mastoid part of the temporal bone.
मम हम वीडियो रिकॉर्ड कर रहे हैं, अभी मत करो, पढ़ रहे हो. अरे तो वीडियो चल रहा है, रुक जाओ. 10 सेकंड हो गए. हाँ ओके, थोड़ा हाँ. I don't know what she come third in. Never mind. So we are continuing.
Still, okay, fine. There's parieto-mastoid suture which lies between
occipitomastoid suture, parieto-mastoid suture.
Occipito between the occipital bone and the parietal bone.
Mastoid bone.
Mastoid bone and the mastoid part of the temporal bone. And this is the parieto-mastoid suture between the parietal bone and the mastoid part of the temporal bone. Clear हो गया? Other features, lambda हमने already discuss करा है. Lambda parietal foramen जिसमें से जाती है parietal emissary vein from the veins of the scalp to the superior sagittal sinus, and also we have talked about the obelion, which is between the two.
That is Safira. Hi baby. सबको इंटरप्ट करना है ना, सबको मतलब यहाँ पे अभी. हाँ अभी ठीक हो रहा है इनफैक्ट. Anyway, never mind. Continue.
External occipital protuberance is a median protuberance in the lower part of the Norma. It marks the junction of the head and the neck. So we see this external occipital protuberance.
You can feel it in Rana's head.
Yeah.
Rana, feel your head now when you're watching this video. Come on.
External occipital protuberance is coming back. External occipital is a median protuberance in the lower part of the Norma. It marks the junction of the head and the neck. The most prominent point is on this protuberance is called the inion.
See, she's marked also right there. Inion. Yes, I see it.
So this is the most prominent part, inion, and the most prominent part is inion. The superior nuchal lines are curved bony ridges. We see these curved ridges that you see. These are the superior nuchal lines.
Yes.
These superior nuchal lines. These also mark the junction of the head and the neck. So basically, junction of the head and the neck. The area below the superior nuchal lines is studied in the Norma basalis. जो हम पता नहीं कब पढ़ेंगे, पर इसके ऊपर वाला है the highest nuchal line or the supreme nuchal line, which is not always present. And 1 centimeter above the perfect gap, 1 centimeter above the superior nuchal line. The occipital point is the medial point, a little above the inion. इसके थोड़ा सा ऊपर is the
occipital point.
Occipital point is the farthest away from the glabella, which is between the two superior ciliary arches. Yeah. Okay, look at this one. So cool this is.
Yeah. Okay. Go on.
Now there is mastoid foramen. We see this mastoid foramen.
You see a mastoid foramen here. I will show you right here. What is this? Wait. Yes, this is my mastoid foramen. See here? That's the mastoid foramen right here.
Here also you see the mastoid foramen.
And
here is the mastoid foramen. And here you can also see the mastoid foramen here.
Okay.
Okay?
Yes.
So these are the mastoid.
Skull gira. Jai Mata Di.
Hello? ठीक है चलो हाँ तो this is the mastoid foramen.
It transmits an emissary vein and the meningeal branch of the occipital artery. I am so cool. if I'm right.
Mastoid emissary vein. It transmits the vein of the scalp. It transmits the emissary vein from the veins of the scalp to the sigmoid sinus.
Sigmoid sinus, remember that. That was superior sagittal for parietal foramen, and this is the sigmoid sinus, remember that.
Okay. And the interparietal bone or the Inca bone, which is
Yeah,
occasionally
it just read this. Mastoid foramen transmits the emissary vein and the meningeal branch of the occipital artery. Yes. Yes.
The interparietal bone or the Inca vein is occasionally present. It is a large triangular bone. Okay, and it's not a sutural or accessory bone, but it represents the membranous part of the occipital bone, which has failed to fuse with the rest of the bone.
So Inca bone, interparietal bone is rarely present. It is a triangular bone.
And it represents it's not a sutural or accessory bone, it represents the membranous part of the occipital bone,
which forgot to fuse.
Attachments. Okay, attachments we see the upper part of the external occipital protuberance gives origin to the
trapezius.
And also the medial 1/3 of the superior nuchal line also gives origin to the trapezius.
So upper part of the
external occipital protuberance and the medial 1/3 of the superior nuchal line gives origin to the trapezius. Now the lower part of this gives attachment to the upper part of the ligamentum nuchae, which we have to find what is it. Anyways, the medial 1/3 of the and जो उसके दूसरा जो lateral part of the superior nuchal line, it gives insertion to the sternocleidomastoid above and the
splenius capitis below.
Splenius capitis below.
Don't tell me there's more left.
Yeah, it's highest nuchal line. बहुत simple है. Highest nuchal line, if present, it ties attachment to the epicranial aponeurosis, which is between the frontal belly and the occipital belly. So if the highest nuchal line is present, it provides attachment to the
epicranial aponeurosis,
which is between the frontal bellies and the occipital bellies of the occipitofrontalis muscle. Here, frontal belly, occipital belly of the occipitofrontalis belly. And in case the highest nuchal line is not present, these structures attach to the superior nuchal line. Jai Mata Di.
Tata bye. JMD.